If you are suffering from any chronic health condition, most likely its cause is not a drug deficiency, but a function deficiency. Now, let me explain. Whether you have chronic migraines, headaches, vertigo, TMJ, low energy, insomnia, often you end up in the medical office, they diagnose you, they name you, and then they throw a drug at you, but they never ask the question what the cause is. So in an upper cervical office like ours, we aren't interested in really naming anything. What we're interested in is finding, do you have a spinal misalignment at the base of the skull that's decreasing your body's ability to function properly? And no matter what you have, it doesn't matter what condition you have or whether you have symptoms or not, if you have a spinal misalignment and it's interfering with the central nervous system, it's decreasing your overall potential health-wise. And so no matter who you are, if you have a spinal misalignment, it makes good sense to correct it so the central nervous system can function the way that it was intended to. Now, if you're suffering with chronic health condition of any kind and you have a spinal misalignment and you get it corrected, it can only help. So our goal isn't to treat symptoms, and it's not to name you, it's to actually maximize nervous system function. And when the body functions better, it gives us the best chance to heal, mend, and repair through an underlying condition so it actually can get out of it. Now, this is not the cause for every condition. However, I've never had a patient who has chronic health problems that doesn't have an upper cervical misalignment, and you can only improve if you get it corrected over the long term. So if you're someone who's suffering with any type of chronic condition, do yourself a favor, do some research on upper cervical chiropractic. It's a niche within the chiropractic profession who focuses all of its attention at the base of the skull. That's where the most vital structure in your body is centered. It's called the brainstem. It controls every single autonomic function in your body, and trauma, as you go through life, can cause that upper neck segment to lock, irritate with the brainstem, and decrease your body's ability to function properly. So it just makes good sense to correct it, to allow the system to work the way it's supposed to. And in many cases, all sorts of different conditions that you would never think are related to your neck are.